Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. And folks, this is episode 246 of the Everything Medicare Podcast. If this is your first time tuning in, my name is Christian Brindle. I'm a Medicare health plan expert and specialist. I run a little company called Christian Brindle Insurance Services, located about 20 minutes outside of Salt Lake City, Utah. We work with people in 38 states on their Medicare health plan. And every single week, me and my company bring you a podcast episode where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And today we're going to be talking about a topic that has not been discussed enough on this platform, on this show, and that is Social Security. Social Security is an interesting thing, don't you think? I like to bring up a little bit of the history. So the Social Security Act itself was put into motion back in the 60s, really around the same time as Medicare. And it was originally designed to allow people to essentially have a cushion built up for their retirement. It wasn't ever supposed to be or intended to be something that people would live off of or essentially live month to month off their Social Security, because you got to understand, and most of you that are listening to this probably do know this, at that point in time when that program was put into motion, it was a much different world. People were working at jobs for 40, 50 years. People didn't bounce around like they do today. It was very common for people to get very strong retirement benefits. It's just a different world, different jobs available, factory jobs, all different kinds of things. The world was a different place. There was no internet. There was no social media. Technology wasn't what it is today. And the population was a fraction of what it is today. This is an important factor of this. When they put a program like that into motion, are they looking forward nearly 60 years ahead at what the program will look like and how many more people will be dependent on it and how much the world will change? Well, of course not. How could you possibly predict something like that? It'd be like me looking at something today in 2021 and trying to get a good idea of what things will look like in 2080, to put it into perspective. I have no freaking idea. Flying cars, right? Chips in our heads, holograms to talk to each other. I really don't know, to be honest with you. Are we on Mars? I don't know, right? As Elon Musk took us to Mars at this point, this is what you got to understand. Put yourself in their shoes back when they put this bill into motion, back when they put this program into motion. It's so incredibly difficult to determine what the burden on the program would be that far into the future. It's like me looking today, trying to predict what things will be like and what the world will look like in 2080. It's just impossible as far as I'm concerned to really accurately predict. We just don't know what's going to happen in our world or in our country or whatever the case might be. But a lot has changed with Social Security over the years. Obviously, the world is a different place. Currency has changed. Economics has changed. And there's a lot of people today that depend on their monthly Social Security benefits almost as their primary, if not their only source of income. They live month to month on it. And that was never the intention of the program. Today, we're going to be talking about essentially how you can get an idea for how much you'll get depending on which age you actually start to draw off of. And this is very interesting to actually kind of dive into. You always hear that the later you wait to draw off your Social Security benefits, the more you'll get. And that's true. So let's just dive right into this, everybody. So you can first start receiving your Social Security retirement benefit as early as age 62. Okay? 62 is the first age you can take it. Now, that being said, you're going to make and get a tremendous amount less at age 62 than if you take it in later years. And what's the right answer, right? Do you want the increased amount if you wait? Do you want the reduced amount but you get it earlier at age 62? A lot of people end up taking Social Security at age 66, 67. Some people actually wait till 70. 70 is actually the final age that you can take it. It stops increasing in terms of your benefit amount after age 70. But what's the right answer? Well, there's two trains of thought with this. At age 62, some people will take it thinking that I will get it for an additional 4+ years, and that will make up for the less amount that I might be getting if I take it later on at age 66. Other people say, well, I think I'm going to live till I'm 85, 90 plus years old. Like, they're betting on themselves. And so they're like, over time, even if I don't get any Social Security benefit from age 62 to 66 or age 62 to 70, it won't matter because I'm getting so much more and I'll live so much longer. And really, no one has a crystal ball, right? Nobody really has an idea for what they're actually going to live to, right? There's so much unpredictability in our world today. And nobody has a crystal ball. It's the same argument between whether you should go with a Medicare supplement plan, take full coverage, pay the extra premium even if you're healthy, or if you should get a Medicare Advantage plan, save the premium, but have increased risk in terms of out-of-pocket. No one has a crystal ball. You could take the Medicare Advantage, and then 12 months to 24 months later, you might dramatically wish you took the Medicare supplement because your health benefits could change dramatically. Your health situation, I should say, could change dramatically. Social Security is kind of the same way. In fact, if you really think about it, a lot of things in life are that way. You have to make it the choice that you feel like is the best decision for you, and you have to make your bed and sleep in it sometimes. But how much more do you make if you start taking your Social Security at 66, 67, 70? Well, let's just dive right into this a little bit here and talk about it. And I'm getting this directly from the Social Security Administration's website, okay? It states that you can start receiving your Social Security retirement benefits as early as age 62. However, you are entitled to full benefits when you reach your full retirement age. Now, your full retirement age is going to depend on the year span that you actually were born in. So, for example, if you were born from between 1943 and 1954, your full retirement age is calculated at 66. So that's essentially, in the eyes of Social Security, looked at as your full retirement age. If you delay taking your benefits from your full retirement age up to age 70, your benefit amount will increase over that time span. Continues to say, if you start receiving benefits early, your benefits are reduced a small percentage for each month before your full retirement age. So, and it gives me a chart here that I think is very, very helpful. It gives a hypothetical situation. Let's say somebody is getting, let's say their full retirement benefit would be $1,000, for example, at age 66, if they took it at 66. Well, this is essentially what they would be looking at in terms of the reduction depending on the age that they actually took it at. Okay. Now, like I mentioned, for people that were born between 1943 to 1954, the full retirement age in the eyes of Social Security is age 66. And they calculate it between the months, not necessarily the years, but the months that are in between age 62 and your full retirement age. So that would be 48 months from age 62 to 66. So 48 months. A $1,000 retirement benefit would be reduced to $750 in that particular scenario. So if someone, let's say their full retirement age was 66, they were born between 1943 and 1954, a $1,000 retirement benefit would be cut down to $750 if they took it at age 62. Be reduced by 25%. On top of that, if they were receiving a spousal benefit, a $500 spouse's benefit would be reduced to $350. $500 to $350, that would be reduced by 30%. in that particular scenario. But what if you weren't born between 1943 and 1954? Well, between 1950, let's say you were born in 1955. That makes your full retirement age 66 and 2 months. 50 months gap between age 62 and that age. So, in that same scenario at age 62, a $1,000 benefit would be reduced to $741, which would be 25.83% to be specific. Spousal benefit would be cut down from $500 to $345, 30.83%. So so depending on what year you were born, if you were born in 1955 and you take it at 62, it would be cut down a little bit of a higher percentage than if you were born from 1943 to 1954. Again, to go back, if your full retirement age was age 66 and it's 48 months from age 62 to 66, a $1,000 benefit would be cut down by 25%, down to $750. But if you were born in 1955 and your full retirement age is age 66 and 2 months, with a 50-month gap between age 62 and that age, it would be cut down 25.83%, and instead of it being cut down to $750, like in the prior scenario, it would be cut down to $741. You follow me on this? Let's say you were born in 1956. A lot of people that are aging into Medicare this year, that is their birth year. That would mean your full retirement age would be 66 years and 4 months, with a grand total of 52 months gap from age 62 to age 66. That means the benefit of $1,000, hypothetically speaking, would be cut down by 26.67% from $1,000 to age 733 if you started to draw at 62, opposed to age 66 and 4 months, your full retirement benefit, if you were born in 1956. The $500 spousal benefit would be cut down from $500, by 31.67% down to $341. And it just goes and goes and goes. If you were born in 1957, the full retirement age is age 66 and 6 months. If you were born in 1958, your full retirement age is age 66 and 8 months. If you were born in 1959, your full retirement age is 66 years and 10 months. And 1960 and later would be 67 on the dot. Now, what if you take it to 70 though? How much more would you make if you take it to 70? And obviously it's going to depend on how many years you worked, how much money you paid into the program, et cetera, et cetera, et cetera. It's impossible for me to tell you exactly what your Social Security benefit would be, but you can determine by how much of a higher percentage that you would get depending on if you wait from age 62. That's what we can calculate very easily here. Now, if you were to take it at age 70, let's use the scenario again for people that were born between 1943 and 1954, and their full retirement age being 66. Let's just use those people as an example. Well, at age 70, they would get 132% of the monthly benefit. Because the benefit being delayed gets them benefits for 48 months. So, we'll use this as an example. If you take it at age, and like I said, we're using the scenario here that you were born from the years of 1943 to 1954. So your full retirement age being 66 years old and 0 months. So this is the situation we're using here. At 66 in that situation, your full retirement age, it'd be 100%. At 66 plus 1 month, it'd be 100.7%. So it's going to be slightly more if you wait a month. 66 plus 2 months, 101.3%, and it just goes and goes and goes. At 67, it'd be 108%. At 68, it'd be 116% of the full retirement benefit. 69, it'd be 124. And at 70, 132, and then it stops growing after 70. So you never, ever, ever want to take your Social Security benefit any later than your 70th birthday. If your birthday is on the first of the month, they figure your benefit as if your birthday were in the previous month. Kind of similar to Medicare. If your birthday falls in the first of a given month, your Medicare starts a month sooner. Usually Medicare starts in the first of your birth month, but not in that particular scenario. So again, if your birthday is on the first of the month, Social Security figures your benefit as if your birthday were in the previous month. So what's the right answer? Well, there's a lot of variables, folks. It's a lot of variables. It's going to depend heavily on how long you live. Nobody knows that. However, if you've got some health conditions, you think there's a chance that you might not make it very long, that's the argument for taking it earlier. If you're incredibly healthy, that's the argument for taking it later. But nobody knows for sure. But what I can tell you is I've seen people that don't take it at all. And they're age 75, 80. That is foolish because there's no benefit. They wasted years of their retirement benefit that they're entitled to. Never wait a day beyond age 70. Never. There's no point in it. I typically most commonly see people take it at 66, but is that the right answer? Not necessarily. Really depends on your needs, your preferences, your financial situation, how bad you need the money. And also, how long you think you're going to live. Crystal ball. Crystal ball here, folks. But it's reduced by a good chunk, a good percentage at age 62. It's paid out in the full benefit at 66 if you're born from 1943 to 1954. And like I went through those numbers earlier, if you're born in another year, it's sometimes 66 in 2 months, 3 months, 4 months, 5 months, 6 months, etc. But age 70, if you wait from your full retirement age to age 70, the benefit increases as time goes on. So it's more than the full retirement benefit. But it stops growing completely at age 70. So all the time that goes by from age 70 on that you don't take it is just money you're throwing in the trash, flushing down the toilet. And that's really as simple as it is, folks. People like to make Social Security very complicated. It doesn't have to be that complicated. And people have been requesting that we do an episode on Social Security benefits and how much more they'd get depending on age and timing of taking it for quite some time. I hope this episode was helpful. I hope that kind of quenched your appetite a little bit on that. Folks, I really appreciate you taking the time to listen here today. If you'd like my organization to work with you on your Medicare health plan, we work with all of the premier insurance companies in the industry across the country. We work with people in many, many places. A list of those states will be listed down in the show notes, in the description of this podcast if you're listening on the audio platform, and in the description of the YouTube video if you're watching on YouTube. Reach out to us. We'd love the opportunity to be able to talk with you. I'd love to talk with you. And just to see, with a no cost, no obligation consultation, if there's anything we can do to help you. Maybe you're turning 65, maybe you're aging in, and we can kind of at the very least point you in the right direction in terms of what your options are. Folks, every single Monday, we'll be here bringing you an episode. This is a really awesome episode. This is some great information. This was an episode that I've been waiting to bring you for some time, and I hope you enjoyed it. I hope you have a great rest of your week as you finish out this Monday, and enjoy the warm weather. As we enter into summer, just enjoy it. Mask mandates are starting to come down all around the country. As life starts to get back to normal, I hope everybody's just in good spirits, healthy, and in a great mental state of mind. Thank you so much for watching, listening. I love you. You're the best audience of all time. And we'll be back next Monday. Take care now.